From Social Prosperity Partners, this is Community Catalysts. Welcome to Community Catalysts, the podcast that examines the qualities of community leadership and the many paths and forms it can take. I'm your host, Matt Lehrman. Typically, we speak with community leaders willing to share after the fact the good, the bad, and the ugly experiences they've had on their journey to leadership. But today, we're taking a different approach. We're going to delve into a current effort, a ballot measure set for this November in Colorado that proposes innovating a first-in-the-nation new veterinary professional role to be called a Veterinary Professional Associate, a VPA. This position is designed to help alleviate the shortage of veterinary care by allowing trained professionals to provide a wider range of services under the supervision of a licensed veterinarian, expanding access to care, especially in underserved areas. I am honored to welcome Dr. Apryl Steele, one of the initiative's proponents with nearly 2 decades of experience in veterinary private practice. Dr. Steele also serves as the president and CEO of the Dumb Friends League, one of the largest animal welfare organizations in the Rocky Mountain region, probably one of the largest animal welfare organizations in the country. She's been there for 9 years. Dumb Friends League has also been a longtime client of Social Prosperity Partners. Apryl Steele, welcome to Community Catalysts, and thanks for being open to this conversation.
Hi, Matt. Thanks for having me.
So again, for full transparency, so everyone knows we've worked together for several years. You've engaged my business partner, John Little, and me for strategic planning services. I'm grateful that you're willing to open up and talk about this. Apryl, let's just start with the basics. Explain what the Veterinary Professional Associate ballot measure would specifically do.
All right. So we know, as you mentioned, that there's a massive veterinary workforce shortage in the United States, probably the world, but we're focusing on the U.S. right now. And in that shortage, we know because of it, there'll be 75 million cats and dogs that go without veterinary care by 2030. And those are owned by people that can afford it, not including the people that can't afford it. So this is a legacy issue for the animal welfare community. We know that there will be more suffering for animals because of the shortage than almost any other cause of suffering that we can imagine. So that's why we're spending so much time, energy, and so many of our resources on this issue. This is one of many solutions, and we need to be clear that this is a yes and solution. It doesn't preclude other ideas, anything that can help the workforce shortage we need to deploy. But the veterinary PA, we use the words PA because people know what a PA is in human medicine. Often people have gone to a PA, developed relationships with them, and really have built trust with that system. So we've used the same acronym, but where you say it stands for Veterinary Professional Associate, like you said. This person will work under the supervision of a veterinarian. So this isn't someone that's going to go out, compete with a veterinarian, be in practice without expertise. They are always going to be working under the supervision of a veterinarian. I will say that there could be exceptions to that in rural areas where there are no veterinarians, and it might be some indirect supervision, but it'll still be supervision. This person will have a master's degree in veterinary clinical care. And so they will be, which is being the first really robust master's degree program is being created at Colorado State University as we speak. And it is one of the top veterinary schools in the country. So the program is a master's degree. These people will go through this master's degree, be highly qualified. And what the ballot measure says is someone that's completed this master's degree while working under the supervision and as delegated to by a veterinarian will be able to practice veterinary medicine. So as it stands now, the only person that can diagnose, prescribe, initiate treatment, or do any types of surgery, so those are kind of the 4 sacred things, are veterinarians, and those are people with doctors of veterinary medicine degrees. It takes us at least 8 years and often 10 to 12 to get that degree, and no one else can do those things. So all of the other solutions, the yes and solutions to addressing the veterinary workforce shortage, draw a very clear line that nobody else can do those 4 things. And this ballot measure would say this expert could do those 4 things as delegated by a veterinarian.
So, April, does this master's degree level education that's required, is that like a step on the way to becoming a veterinarian, or does this become a brand new classification in its own right?
It's a brand new profession in its own right. So the last thing we need to do is add more steps to become a veterinarian. It's already quite a complex process. Last year at Colorado State University, over 3,500 people applied for 150 seats in the veterinary school. It's really tough to increase class sizes in veterinary school. And it's also not accessible for many people in our community to spend that much time in higher education before they start earning money to raise their families. It's veterinary medicine is the whitest profession out there, and we really, there's a lot of reasons. Access to veterinary care is one of the major reasons that we think the VPA is necessary, but increasing diversity within the field is really important as well, and having an accessible career path for folks. We also think it's really important for veterinary technicians who have most of them have a 2-year associate's degree, and they support veterinarians right now. Again, they're not allowed to diagnose, prescribe, initiate treatment, or do surgery, so they can really help with the veterinary workforce, but they can't help enough and you need extra education to do that. But currently, these veterinary technicians with a 2-year associate's degree have no career path. That ends there. So typically, a veterinary technician is in the field for only 5 to 7 years, and they go back to school go to human medicine because they don't get to stay in the profession they love because there's nowhere for them to go. This is also a really vital career path for veterinary technicians to move their careers forward.
Yeah, so explain the process here. What is the difference between a veterinary technician, a vet tech, and a veterinary PA as being proposed?
Yeah, so veterinary technicians have a 2-year associate's degree, and they support the veterinarian and the care of the patient. So they do all kinds of things, and they're vital to the work of the practice. They often do the client communication. They check in the animals. They get their vitals. They can clean teeth and scale and polish teeth. They place IV catheters. They intubate. They do all of those things. What they cannot do, as restricted by state practice acts across the entire United States, is they cannot diagnose, prescribe, initiate treatment, or do surgery. So the difference would be, this would be people that have this experience, that have learned to do all these other technical things, but now they are given 2 more years of training and actually identifying disease states, initiating treatment in those states, understanding what their scope of knowledge is and where it ends, so they know how to delegate it back appropriately or return it back appropriately to a doctor of veterinary medicine. But it is a much more robust training program to build on what a veterinary technician would already know.
So a veterinary PA would then have 4 years of schooling?
This is interesting. So the veterinary PA program is a master's degree program going through its final approval at Colorado State University. Right now, CSU requires all master's degree programs to have a bachelor's as a prerequisite to get in. So right as it is written now, they would have a bachelor's degree, and then they would go to 2 years additional training to become a master, have this master's degree, and become a veterinary PA. It is the intention long-term to make this program accessible without requiring a bachelor's degree first, because veterinary school does not require a bachelor's degree first. So it doesn't make sense to make the requirements to go into the PA program more robust than the requirements to go into veterinary school. Initially, though, to get it through the approval process, that is what is going to happen. So a bachelor's degree, and then they'll be able to go into the master's degree program.
I have so many questions, April, I want to ask, and I'll get more into the details of how you're bringing this about, but I want to make sure I understand. You said that the reason for this is because I think you said 75 million pets, that's nationally?
That's cats and dogs nationally, yes.
Help us understand, what is the correlation between the number of veterinarians and the number of pets? And maybe do you have that nationally, or do you even know that for the state of Colorado?
Yeah, I know that we have enough veterinarians to serve about 75 million pets a year, and there are about 150 million pets in the United States. And I don't want to make this too complicated, but we have an even bigger crisis in rural places in the United States and in food animal medicine. And that's an animal welfare issue as well. That is something that there are plans to address over time, but it's not going to be the first step. We have to get this approved as a first step. I will say that the ballot measure does open up the opportunity to address that. It's just the program to create the masters that focuses on livestock is level 2, level 3. It's not where we're starting. So we have about enough veterinarians to serve about half of the animals in the United States.
What does that mean? That half of the animals in the United States don't get veterinary care?
When you look at it from those numbers, that is correct. When you do surveys of pet owners to ask them if they go to the veterinarian, it varies between 60 and 70-ish% say that they have at least been to a veterinarian once. I can tell you from personal experience, we have a subsidized veterinary hospital at the Dumb Friends League, and this hospital only serves people who can't afford market rates for veterinary care. We have 8 doctors, veterinarians at that hospital. We open up for urgent care at 7:30 in the morning. By 8:30 in the morning, we have to tell people we have no more appointments left. I know your pet will probably die today without care. We simply have no one to see that animal. There's nowhere else for those people to go. So it's a real crisis. We also are hearing from pet owners across the United States that the annual rate of 10% inflation in veterinary fees has made it so they cannot go to the veterinarian. They cannot afford to go to the veterinarian. And that doesn't mean they don't care about their pets. They care deeply about their pets, but they just can't afford it. And then on top of that, we're also seeing people that can absolutely afford veterinary care, but can't get into a veterinarian, whether they're not accepting new clients or their schedules are full or it's so far out. Just my assistant the other day, her dog had a stick go into its eye and it was an emergency. They couldn't be seen for 3 days. And it's just so sad to understand what's happening to animals just because of this veterinary shortage.
Okay, Apryl, I think maybe we need to give some context here because people outside of Colorado may never have heard of the Dumb Friends League. You're not operating a little mom and pop clinic over here. Can you talk a little bit about the scope and size of Dumb Friends League and what you do?
Yeah, I'd love to. So we have been an animal welfare organization since 1910. So we've been around a little while, and we have 5 regional centers. So we serve about 22,000 animals a year at our 3 shelters. And those are animals who are being rehomed because people cannot keep them. Often it's cost of veterinary care. Sometimes it's housing, sometimes it's life issues. But so we have 3 large shelters, 2 in Metro Denver and 1 in rural Colorado. To help be a resource and provide socially conscious sheltering for those animals. We also have an equine center, and that equine center helps law enforcement to impound horses when they're in cruelty and neglect situations. And so we will help transport them, we will house them, we will feed them, we will heal them. And then through the court system, if they get turned over to us, we will then train them and adopt them out. And we adopt out typically about 200 horses a year through that program. And then finally, we have this community veterinary services part of our work, which has grown so much in the last 3 years. We serve as many animals in our community veterinary services as we do through our shelters now. So another 23,000 animals are served through our urgent care subsidized veterinary hospital, our spay-neuter clinics, and our vaccine clinics every year. Currently, we just passed our new fiscal year budget, and we're at $35 million annual budget right now. We have 310 employees, and many of them are they're professional employees that are highly compensated because they're veterinarians and veterinary technicians and et cetera.
So Dumb Friends League, as I understand it, is a 501c3 nonprofit organization, right?
That is correct.
Is the Dumb Friends League allowed to advocate for a ballot initiative like this? What's the mechanics just involved of getting this on the ballot?
Right. So there are kind of 2 things that relate to that question. One is no 501c3s cannot advocate for or against any particular candidate. So we're not doing candidate work and make that really clear. When it comes to policy, we can do so as long as it doesn't exceed the IRS threshold. And so it's based on our annual budget, and we are able to support this work because it's so aligned with our mission to end pet homelessness and animal suffering. But we have to make sure we don't exceed a certain threshold in doing that. The Vet Care Coalition is the leading 501c5 that is leading this conversation, but the Dumb Friends League is the biggest driver and funder to date for it.
Let's talk about the veterinarian profession as a whole for a second. I had to go do a little bit of statistic research on my own. According to the American Veterinary Medical Association, as of 2022, there were about 125,000 veterinarians in the U.S. and about 80,000 of them actively working in private practice. That's the numbers that I was able to find. But given the huge number of pets, I had to do the math. That's approximately, and I know this is gross general national numbers, but it's approximately one veterinarian for every almost 1,400 pets, every 1,400 dogs and cats. And I just, out of curiosity, I went and did the comparison of how many physicians there are for humans in the United States. And so if it's one vet per, call it almost 1,400 dogs and cats, it's one physician for every 352 human beings. What does that tell us about the strain and the pressure on the veterinarian profession?
Excellent question, and thank you for doing the math. What it tells us is that we have way too much we're asking of our veterinary profession, and we know that we have a very high mental health. We have very high rates of mental health challenges and very high rates of suicide within veterinary medicine. We know that many veterinarians, I think it's 40% of veterinarians want to work fewer hours even if they get paid less. We have people leaving the profession because they can't deal with the strain and the pressure putting on them to see more patients. I call veterinarians compassionate perfectionists. And so what we are is we want to do everything right. We want to meet our clients' requests and demands. We want to care for our patients to the best way possible. And we really are upset if we make a mistake. And on top of that, we don't have enough people to provide that kind of service. We don't have enough trained veterinarians to do that. And so it is a disaster for creating severe mental health challenges. And we're seeing that manifest within veterinary medicine. Veterinarians are wanting to retire earlier. They're wanting to work fewer hours. It's not a good recipe or equation to create access to veterinary care and to care for the people within our profession.
There's something that you left out of that. I'm curious, at least I was expecting you to say, which is that veterinarians are also dealing with, intense life and death decisions for their patients, and obviously then for the families of those patients. And is that the difficult psychology underneath it? It's not just the workload, it's the emotional content of the workload, isn't it?
It's absolutely the emotional content of the workload. That's why I called it compassionate, because we're dealing with others' discomfort. And there are so many great, happy things that happen in veterinary medicine, right? It's a roller coaster every day. I do think most veterinarians, including myself, do find performing euthanasia, which is, I think you're getting to some degree, as important part of our work. And many times we feel like it's a gift because suffering is worse, and watching an animal have a relief from that suffering is a gift. But that doesn't mean it doesn't weigh on you. It doesn't mean that it doesn't build up over time. And when you've had to help families manage through that grief and their sadness over and over and over, it does affect your mental health. It does affect your job satisfaction.
So I gather that not everyone is in favor of the initiative. Tell me about some of the headwinds that you're encountering. And I think they're coming from a surprising place.
Yes, they are. And I try not to have too much judgment about this and try to see the perspective of the people in opposition as well. So the strongest and pretty much only opposition is coming from the organized veterinary trade associations. So the American Veterinary Medical Association and the Colorado Veterinary Medical Association, their own words are that they are going to vigorously defend against this ballot measure, and they've invested hundreds of thousands of dollars in Colorado to do so. There is mixed support and opposition from veterinary technician associations. Some feel very strongly that this is a great career path and they want to support it. And some feel like you should just utilize veterinary technicians more. And why would we create a new field? I want to be very clear. Veterinary technicians cannot diagnose, prescribe, initiate treatment, or do surgery. So it's not even an option to use them more for these things. It's not legal. But to go back to the veterinarian profession, I truly believe it's fear-based. I believe that veterinarians are really good at diagnosing what's wrong with the situation. That's what we're trained to do. And there's a fear that their salaries will decrease if there's more professionals offering veterinary care. There's a fear that veterinary care may decline in quality and that animals will not get the care that they deserve. I will say that the business models that are completed and in the process of being published right now, so the timing's a little tricky, show that veterinary practices will only grow with a veterinary PA. And that's what happened in human medicine as well, that veterinarian salaries will increase with a veterinary PA, not decrease. And, many veterinarians are not small business experts, unfortunately. But if you think about it, it's pretty obvious if your business model choices are declining new patients, declining clients, not doing any new business because you don't have anyone to provide the service, or hiring a PA and being able to see those folks. The supervising veterinarian will get a percentage of that production as additional salary towards what they make annually. The practice will make money on the veterinarian PA, and then the veterinary PA will have their own salary, and then people will be able to access veterinary care. So I feel and know that the fear that veterinary salaries will go down is a fear that is really unfounded. There's no models that are showing that. The models are showing all of the opposite outcomes of having a veterinary PA, and we can look to see what happened in human medicine as well. We have to increase access to veterinary care. We have to have people seeing these animals when they're sick and injured, preventing them from getting sick and injured, and we simply do not have the people to do it.
Apryl, this is the place in the conversation where I hope we can go even a little bit deeper into the good, the bad, and the ugly, because I want to maybe time travel a little bit, right? This initiative just didn't materialize out of the air and plop down for this election season. You've obviously been working on this, and I imagine there have been discussions with the veterinary profession for some period of time. Can you kind of just walk us back through some of the history of how has this concept been discussed?
It's so interesting because about, I don't know, maybe 4 or 5 years ago now, the Colorado Veterinary Practice Act was up for sunset review. And, in preparation for the sunset review, the Colorado Veterinary Medical Association put together a task force to discuss the Practice Act. So the Veterinary Practice Act says who can do what when they practice veterinary medicine. So it's the one that says only a veterinarian can diagnose, prescribe, initiate treatment, or do surgery.
And that's not a permanent legislation. It has to be revisited periodically?
Yeah, it goes through a sunset review on a cadence, and different reviews then indicate what the next cadence is. So it's between 5 and 10 years, depending on what the Practice Act is. So I think this was about a 7-year review that we were going through. And the state asked, the Department of Regulatory Agencies, or DORA, asks the State Veterinary Association and many other stakeholders, what's working? Is this profession meeting the needs of society? And that's a key question here, as you can imagine, because we're not meeting the needs of society. So the Colorado Veterinary Medical Association put together this task force. I was allowed to serve on that task force. That task force had about 12 veterinary professionals, and the recommendations that went to DORA out of that task force actually included creating a mid-level practitioner. And that was one of the official recommendations. However, soon thereafter, the American Veterinary Medical Association and the Colorado Veterinary Medical Association got into conversation, and there was a lot of fear that developed around this idea. So that did not get included in the sunset review recommendations. So we moved forward and we obtained bipartisan support in the House and the Senate at the state level for a bill that created a veterinary PA. And we're so excited about moving forward. We had a lot of support. However, there is one legislator in the House, Representative McCormick, who is a veterinarian, and she aligned very closely with the AVMA and fought this and actually was successfully able to block it from being introduced, despite the very strong support. So we knew then that that was going to be a challenge, and she was then present the next year in the body as well, in the legislative body, and was able to block it. So we knew that we needed to move forward with pet owners having a voice in this, because pet owners had no voice in that conversation at that time. With that information, knowing that we are speaking for those who cannot speak for themselves, we moved forward with the very complicated and expensive and time-intensive process of a ballot measure in Colorado. And we needed about 124,000 signatures, and we turned over 200,000 signatures in, because people are just so much in need of this opportunity. So it did cost a lot more money, and now we are facing this public campaign that's quite honestly quite misleading. It's called Keep Our Pets Safe, and it's saying that people with no training will do surgery on your pet, and it's really frustrating because it's the opposite of what is really going to happen.
So tell me a lesson or two that you've learned about what it takes to build a successful coalition around a ballot measure like this.
I think the first lesson is everyone is really, really busy. And so people can care so much about the issue. They'll come up to you, what can I do? I'll do anything. This has to happen. And then when you call them and say, hey, we need these 3 things, they're like, oh, maybe I can do that in a few months. But you don't have a few months for a ballot measure. Everything's happening so quickly. So there's a lot of pressure about who's going to do what when, and even when people are really excited about the initiative, I've learned that you have to really downgrade your expectations on where people can deploy their time without much warning. So that's one thing. I think the other one is fear is powerful. And I think we've seen that in a lot of different places in politics and in policy. And if there's a way to get people to be courageous and have the conversation despite the fear, you can often get somewhere that will create some really good change. So to slowing down and taking time to have those conversations, not judge the fear, know that the fear is real fear, and helping people get out of that place of emotion into a place of curiosity is probably one of the most important things we can do.
I think my last big question for you here is kind of turn this around now. So to win the ballot proposition, you have to educate the public, and you also have to motivate them, right? You have to make this something that they actually care about when they go to take their vote. So what's the core of that campaign? How do you do that?
That's what we're figuring out. So getting them educated, I think, is the challenge right now because of the misinformation that's coming out and how that keys into fear. People just want to do the best thing they can for their animals. And if they think this is going to help their animals, they're going to vote for it. If they think it's going to hurt their animals, they're going to vote against it. So we need to make sure they understand really how it will impact veterinary care for animals. Motivation is pretty darn easy for us. People care so much about animals. I think that's true pretty universally, but definitely in Colorado, we have a very animal-friendly state. The amount of conversation around animals and advocacy for animals is overwhelming and overwhelmingly positive. So we're less challenged by the motivation aspect than we are the education aspect. We are working with a campaign specialist who is helping us with messaging, and it's all the things you can think of, the digital ads, the social media, probably not TV ads in a presidential election campaign, or unless someone wants to fund this. If someone listening wants to help us with this, just give me a call and we can do it even more.
If this ballot measure passes, what direct impact do you think it'll have on Colorado families and their pets? How will they know that something has changed?
So it's going to take a couple years. because we have to get these master's degree people trained, right? So it's a 2-year program. And if everything goes the way that CSU hopes it will, in fall of 25, they will start their first class. So not a lot's going to happen immediately. But in the next couple of years, what will happen is veterinarians will start hiring these PAs as they graduate. And when you go to see a veterinarian, you might be asked, do you want to see a veterinary PA, or would you be willing to see a veterinary PA? It'll take us 3 weeks to get you in with a DVM, but it'll take us 3 hours to get you in with the PA, and people have more access. Hopefully will experience more accessibility for those appointments. We also know that there is quite a bit of funding for subsidized veterinary care for people that can't afford veterinary care that's going unused because you can't hire a veterinarian to provide the service. So there are national groups and local groups that are trying to fund that work because they care deeply about pets, but there's no one to hire. So hopefully you'll see PAs doing a lot of that work with the veterinarians and being able to increase the opportunity for people that can't afford market rates for veterinary care.
So if I was going to look out 10 years into the future or so, do you think that the world of veterinary care will be substantially different in Colorado?
I think in 10 years, it'll be substantially different nationwide. There are so many states watching what's happening in Colorado and just ready to deploy a similar opportunity if it's successful in Colorado. So this is really a pivotal point for incredibly fast and systemic change that can happen over the next 10 years.
Well, you are leading a tremendous innovation in the field of veterinary care. I wish you all the best, and thanks for the opportunity to kind of look under the hood at what it takes to get this done. It's an immense challenge.
You bet. Thank you for the opportunity to share it. It has been quite a journey.
Dr. Apryl Steele, thanks for being open to this conversation, and best of luck with the vote.
Thank you.
Once again, my thanks to Dr. Apryl Steele, President and CEO of the Dumb Friends League in Denver, Colorado. And in the program notes, you'll find a link to the Veterinary PA Ballot Initiative website, allpetsdeservevetcare.com. This episode was edited by Nick Living the Dream Tantillo. Our executive producer is John Little. I'm Matt Lehrman of Social Prosperity Partners. Ask me a question, share a comment, or let me know that you have a story to share. You can reach me at 602-688-2724 or Matt at socialprosperity.us. I'd love to hear from you. We'll be back soon with another Community Catalyst.